I was moving documents around, and I had a suitcase full of documents, and as you know, files can be very heavy. And I slipped and fell, and the whole suitcase with these heavy files landed right on my hip, left hip, down to my knee, and I knew that I'd had a serious injury. So I came back to Dr. Bajaj, and we went straight with the stem cells with the PLP, and it was great. Perfect recovery. I wasn't interested in any more surgery after the bad experience I'd had with the rotator cuff. We did stem cells and PLP in my knee and in my hip, and perfect recovery. I was walking the next day. It was painful, but I had no problem walking. And then I just had an amazing recovery, 100%. Well, I was having a lot of pain trying to walk with the hip and the knee damaged. And I was dragging my left leg, and there was no way I could walk normally. Now, I had the blood platelets injections with the stem cells on both the knee and the hip. And the next day, I was actually walking. I was in pain, but much less pain. And then it gradually improved into 100% recovery. But I was actually walking the following day without anybody noticing that I'd been injured.
So Ms. Siegel initially came to us a couple of years ago with complaints of hip pain. She's a very active individual, and she had been involved in a slip and a fall. She had chronic hip pain with signs of degeneration, and she was potentially going to have surgical intervention. We obtained a full history physical examination. We obtained imaging studies as well, revealing the findings we just discussed. And after talking about her options, including surgery, multiple cortisone injections, ongoing physical therapy indefinitely, and regenerative medicine technologies, we decided to move forward with a stem cell injection directly into the hip. We obtained the stem cells from her bone marrow, which we obtained from her hip. That process took about 15 minutes or so, and re-injected the stem cells. She then came back to see me about 3 months ago, at which point she stated her hip was doing fantastic. She was very active. She was doing very, very well. However, she suffered another slip and fall, and she hurt the other hip. At that point, we went through the same vigorous process of history, physical examination, and imaging studies, and we determined, because she did so well with her previous stem cell injection, to go and try that on the other hip as well. And that's exactly what we did. So we did a very unique combination for her. We did a stem cell injection with PRP at the same time, followed by a PRP booster about a month later. The reason we did that is because the stem cells have a multitude of growth factors, as well as what we call MSC, or mesenchymal stem cells. But those stem cells, for optimal benefit, can always benefit from additional growth factors. The added PRP provided the growth factors to those mesenchymal stem cells, and that helped flourish the process. About a month later, we delivered more PRP, aka more growth factors, which further helped propagate the healing process. And to date, she's doing extremely well. Both her hips are doing much, much better, and she's enjoying a very high quality of life. So oftentimes when we elect to combine stem cell and PRP, what we do is we'll do an isolated PRP extraction procedure with a blood draw, and then an isolated stem cell extraction procedure with a bone marrow aspiration. We'll then take those two highly concentrated liquids, we'll combine them, and then we'll inject that entire mixture into the affected area.